4-flap combination procedures are used to maximize the amount of volume of tissue that can be harvested from a breast cancer patient in order to reconstruct 2 breasts. In thin patients who desire the use of their own body tissue or autologous breast reconstruction, sometimes one donor site is not enough to supply enough volume to make 2 breasts. When this is the case, flaps can be harvested or taken from various areas on the body and combined in order to reconstruct a breast that is the appropriate size and shape for a given patient. We call these procedures combination flaps, and they typically involve the use of flaps from the abdomen or the DIEP flap combined with flaps from the thigh or the PAP flap. The combination flaps are done in the very same way that the DIEP flap and the PAP flap are done, with the vital difference that these flaps are combined together. Typically, one half of the abdomen or hemiabdomen as a DIEP flap is combined with one PAP flap on each side of the patient for each breast reconstruction. These flaps are harvested simultaneously, brought up to the chest, and each one is provided with its own blood supply by attaching its vascular pedicle or the blood vessels that supply it to blood vessels in the chest. The recipient blood vessels in the chest typically are the internal mammary artery and vein. Once each flap has its own blood supply and is well perfused, most of the skin from each flap is removed, and these flaps are then stacked together and shaped together to reconstruct each breast on either side of the patient.